Welcome to your Barbados Today Evening News Update for Wednesday, April 29. Prime Minister Mia Mottley this evening rolled out a plan for the country to emerge from lockdown. She stressed that public health will not be compromised, even as she announced the resumption of some activity.
The following sectors, therefore, will now be open for Phase 2 on Monday, May 4th. I want to repeat myself for the avoidance of doubt. We will be moving to Phase 2 on Monday, May the 4th. And everything that was allowed to function in Phase 1, and you know what they are, from the limited operations of banks and supermarkets and hardware stores, etc., they will continue to function. For the absence of doubt, therefore, please remember and look at the documents that are already out there that would have guided you over the course of the last few weeks. Similarly now, we want to add these sectors that can be carried out. Anything that can be carried out fully at your house, fine. Online, fine. But we want to add now construction and mining, landscaping, gardening and pool services, food and beverages, manufacturing and retailing. So it's not the actual restaurant, it's the manufacturing and reselling of food and beverages. Supermarkets, as I said, finance and insurance companies, legal, accounting, and other professional services to support businesses, particularly those businesses that I said just now are already open, tradesmen like joiners and upholsterers and welding workshops, automotive stores and workshops that are necessary to support the maintenance of a safe public transport and private transport system, electronic stores other than for mobile ICT matters, retailers of baby products because mothers are still having babies, building supplies, beauty supply stores. I know that a lot of people are getting very fretful and they may have to do some stuff on their own before we reach to the next level where those people we are accustomed going to, we can go back to in a safe way. And we're working hard on that. Health and medical services have already always remained open. Office equipment and supplies, pet services and supplies, because equally pets are living animals and therefore they need to be able to have access to medicine or to whatever else they may need for us to keep them safe. Safety equipment, security products and services, marine products distributors, educational suppliers, dry cleaning and laundry services, distribution and printing supplies, delivery companies.
Read this evening's e-paper and visit our social media platforms for more from the Prime Minister's address. In a separate forum earlier today, Prime Minister Mia Mottley made a strong case for our new global leadership initiative to be set up post-COVID-19 to better respond to the needs of vulnerable small island developing states. She made the call during a live television interview with Christiane Amanpour on CNN International.
75 years ago, the United Nations was formed on the 24th of October. We used the opportunity of post-World War II to create a number of vital institutions to be able to bring countries together to protect the most vulnerable, the weakest among us. We also used it to create the Bretton Woods institutions, which we're relying on. But we need to repurpose these organizations and in having a global leadership initiative, make sure that we are really reacting to what is real. We are told that we can access concessional funding or grant funding only if we have historic per capita incomes that are below certain levels. Well, Christiane, that is like telling me that I should use my blood pressure reading from 2 years ago to determine whether I'm vulnerable tonight to a stroke. It's absolutely futile. And we've been carrying on this thesis and argument for over 30 years. We also had problems when the WTO was formed. We recognized, for example, that much of our domestic production would shut down and it would make us more open. When we had 9/11, we had other issues that were imposed on us on a one-size-fits-all prescription. Now we have this pandemic. We need global leadership similar to what we had post-World War II to be able to recognize that we need a plan that protects not just the strongest among us, but also the most vulnerable. And what should we really be spending money on? Does it make sense to continue to build large military constructs when, as a result of a mosquito or a pandemic, our populations can be put at risk? It doesn't make any sense.
In other news this Wednesday, a seventh person died from COVID-19 in Barbados. The deceased is a 78-year-old Barbadian woman who arrived on the island on March 12th. The patient, who had diabetes and hypertension, was on a ventilator for 33 days. Meanwhile, there were no new cases of COVID-19 recorded overnight. All 75 tests conducted by the Best dos Santos Public Health Laboratory, 2 of which were employees of the National Assistance Board, came back negative. This brings the total number of tests to 2,005. To date, the island has recorded 80 confirmed cases of COVID-19, 39 persons have recovered, while 34 persons remain in isolation. There's no reason to fear home health workers from the National Assistance Board. Health authorities gave this assurance this evening amid earlier reports of public concern after one home helper tested positive for COVID-19, in addition to 5 members of the NAB's office staff. This morning, Acting General Secretary of the National Union of Public Workers, Delcia Burke, told reporters that some members of the public have been turning away home helpers.
Some of them have said they went to work on Monday and they face discrimination from the public. Persons have asked them not to come into their houses, have shut down the houses when they see them coming, and some of them have said to them, we will take care of our families also.
But health authorities made it clear that all 236 members of staff of the National Assistance Board have been tested for COVID-19 and the results were all negative. Acting Chief Medical Officer Dr. Kenneth George explained that personnel from the Ministry of Health has been engaged in rigorous contact tracing since the first case was discovered, and they are satisfied there is no additional threat to the public. In other news this Wednesday, the men and women of the Sanitation Service Authority got a special treat today. A big thank you from government, union leaders and Barbadians for their hard work on the COVID-19 front line. In a festive environment at the SSA's Wilty Depot, workers were treated to loud applause. In his brief address, Environment Minister Trevor Prescott reminded the workers they were important as he praised their contribution to the nation's development.
I understand clearly your commitment. I understand clearly your courage. I deeply appreciate it, your commitment to the country in general, and I believe that you ought to be honored for everything that you're doing. I know how it is to work, although I never worked on one. I never even had any exhibit on the back of one. But I know for sure that you travel every day in the hot sun for hours, enjoying the order, lifting up heavy drums. So I am cognizant that you work extremely hard and much harder than some of the people who place judgment on you as workers. And I will be here for you. I want to give thanks to you. I want to give thanks to you not just as workers but as brothers and sisters in the sanitation department. And I want to let you know that wherever there's a challenge, you can feel free to call on me as the minister. I will hear your cries. I can empathize with those cries, probably because of my strong beliefs. I don't see nobody as worker and employer. We are family.
Later in the evening, more frontline workers were treated to their weekly round of applause led by Clap Barbados. In addition to medical workers, staff from the NIS, the Barbados Port Inc., the Immigration Department, Light and Power, the Barbados Water Authority, emergency management technicians, polyclinics, gas station workers, farmers, and security personnel were all shown appreciation by Barbadians from all walks of life. Here at School Gap Hinesbury Road, community leader Marva Lashley Todd says they were happy to participate.
We just decided to come out to support all the online workers because my sister there, she works at the geriatric hospital. I also have a friend here, he's the warden there at the supply shelter for homeless people. So we just want to salute everybody, all the garbage people, all the frontline workers, everybody that people don't even think about, even the gas station people. Because nobody's going to look at them as essential workers, but they are. Because if nobody don't go and sell gas, we can't get the gas to get around to do our work. Right? So we just want to support everybody, support all the online workers, clap for them. And we will continue to do this. I did it last week. I did it physically last week.
Essential workers.
I know, I'm telling you, the essential workers. So I went in the area, I went to every house, tell everybody, come out, be clapping. So the people really come out, all in Dr. Caroline, Hinesbury Road, School Road, Prescott Bottom. Everybody come out and support.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news in St. Lucia, government is not backing down to prohibit the sale of alcohol as part of COVID-19 restrictions, despite mounting criticism from the public. More in this report from HDS News Force.
Commerce Minister Bradley Felix disclosed that the suspension of liquor licenses still stands.
There's a lot of conversation and discussions that we had with regards to that sector because, yes, there are quite a bit of requests coming in, and the argument for the opening of or the lifting of that suspension is growing stronger and louder. But the cabinet collectively decided that at this point in time we would give some additional time before the suspension is lifted.
Critics argue that while bars and liquor shops remain closed, St. Lucians should be able to buy alcohol off the shelves for personal consumption. Felix speculates that there may be a shortage of liquor due to bar owners selling alcohol.
On the international scene, America's top infectious disease official said an experimental antiviral drug by Gilead Sciences, Inc. will become the standard of care for COVID-19 after early results from a key clinical trial showed it helped patients recover more quickly from the illness caused by the coronavirus.
Gilead Sciences on Wednesday delivered encouraging news about trials for its antiviral drug, remdesivir, to treat COVID-19, saying it helped improve outcomes for patients and provided data suggesting it worked better when given earlier in the course of infection.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery.
The nation's top infectious disease specialist, Dr. Anthony Fauci, welcomed the results at the White House on Wednesday, saying this is significant because it shows a drug can block the virus.
We think it's really opening the door to the fact that we now have the capability of treating, and I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better and better.
The company provided updates on 2 clinical studies currently underway in a trial run by the National Institute of Allergy and Infectious Diseases. Gilead said that remdesivir met its main goal of helping patients with the disease.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.